Nope, that doesn't help.
Welcome, everyone. Thank you so much for joining us this evening. I'm Lori Marie Pashota. I'm the Executive Director of the Mental Health Association of Rhode Island. We are a small nonprofit, and our mission is to improve and nourish mental health through policy development, advocacy, and education. Tonight's event is in honor of Suicide Prevention Month. These are dark times for many of us with the pandemic. I think it's fair to say the pandemic has led to chronic stress for most people. And some of us may even be struggling right now with our mental health. And there's no shame in that. There are about 1 in 5 Americans will be diagnosed with a mental illness in any given year. And about 50% of us will have a mental illness diagnosis across our lifetimes. So if you are living with a mental health, substance use disorder condition, you are welcome here. This event is meant to give you resources, information, and hope, and to let you know that you're not alone. A couple of housekeeping tips. This event is being recorded and it will be placed on the Mental Health Association's YouTube page, where you can refer back to it or share it with others who couldn't join us this evening. And if you have a question, please type it into the Q&A box, which you'll see in your menu. And we'll probably take questions as we go along, but we'll certainly get to them at the end. And we welcome all questions. So we have a very special panel tonight, and I want to thank them for joining us. I know that everyone is very busy, and I don't take your time for granted. So I want to welcome tonight Dr. Prachi Kene. Dr. Kene is a professor at Rhode Island College in the Department of Counseling, Education, and Leadership and School Psychology. Welcome, Dr. Kene. We also have with us tonight Dr. Rob Harrison. Dr. Harrison is a retired physician, and he's also the director of Washington County's Zero Suicide Program. Welcome, Dr. Harrison.
Thank you.
And we have 2 special guests tonight. We have 2 individuals who are here to share their stories with us. I feel very grateful for them, for their willingness to talk about their experiences with us. It takes courage to do so, and I really appreciate having you here. We have Annette Joseph. Annette is a certified peer recovery specialist and a certified community health worker. And right now she is the peer recovery program coordinator and resource specialist at NAMI, Rhode Island. So welcome, Annette. Thanks so much for being here.
Thank you.
And we also have Jeremiah Rainville. Jeremiah is a certified peer recovery specialist and also a certified community health worker. And he is the peer program manager at NAMI, Rhode Island. Welcome, Jeremiah. Thank you for joining us. So we're very grateful to have you here. Mental Health Association partners quite often with NAMI, Rhode Island. And I want to give a shout out to NAMI. NAMI provides support groups and peer support services, and they have robust educational programming. And I encourage everyone to go to NAMIRhodeIsland.org and check out all that they offer. So thanks again to our panelists for participating tonight. I'm really excited to hear everything that you have to share. And I'd like to start by asking a question of our 2 mental health professionals. So the question is, what are some signs or some symptoms that someone may be living with a mental health condition, substance use disorder? What would cause concern that someone might want to talk to a professional? And I can start with Dr. Kene.
Absolutely. So that is a really good question. There are a wide range of symptoms for someone that is struggling with either a mental illness and or a substance use condition. But there are certain categories, and we see some dramatic changes. There might be changes in mood where someone is struggling with depression, or they might have suddenly elevated mood. There might be just like changes in their thinking, which can be a full spectrum again, from thinking that they're a failure to having some delusions that are disconnected from reality. Like impairment in concentration, impairment, they are not able to sleep, their appetite changes, they are not able to cope with the stress, and they may be using alcohol or other substances to manage these difficulties. And the second part of being diagnosed with a mental illness is that these symptoms have to cause an impairment in their functioning, so that they are not able to fulfill like their social or occupational roles, or their family member, partner, or friends might have expressed a concern, or they might not be able to maintain their work, their employment. So those, I mean, very broadly, like those are some of the signs and symptoms of mental illness, substance use disorder.
Thank you so much, Dr. Kene. Dr. Harrison, do you have anything to add to that?
I agree with all that Dr. Kene has said. Other things that you might notice would be a tendency for isolation, giving up friends, or maybe changing friends dramatically, but sudden changes, giving up activities that they've usually enjoyed, and not picking up any other activities to replace them. Things like that, all things that you can observe in what's going on with someone. But I think Dr. Kene covered it very well.
Thank you, Dr. Harrison. Thank you both. And now I'd like to pose a similar question to Jeremiah and Annette. And I'll just say up front that I am a person who also has lived experience with mental illness. I don't want to chime in here, but I just want to say that I appreciate your willingness to share your experiences as well. And you're not alone. Annette, my question is, when did you know that it might be time to talk to a mental health professional about what you were experiencing? What was a sure sign that something, that something was not the norm for how you usually are or how you usually feel?
Well, I didn't know it then, but I was having a nervous breakdown. And I was in my house all alone, and I just trashed my whole house. I put the computer through the wall, and someone heard the noise, and my cousin lived upstairs, and they went and they told him, and he came downstairs, and he said, "Oh my God, something is wrong with you. I'll tell you what, because if you let me clean up the house and fix it up and everything like nothing ever happened, so management won't hear about it and come up here, or if they do, it won't be trash. But I want you to go to the hospital to go get help because you need help." And that was the very beginning. And I've been on that journey of recovery ever since.
Thank you for sharing that, Annette. That sounds like it was a really profound moment in your story and in the start of your healing journey.
I had no choice because I knew I wasn't in denial. I didn't say anything to him, but I said it to myself. Yeah, something is wrong. What am I doing here? What in the heck am I doing here? Yeah, something that never happened before.
Thanks so much, Annette.
You're welcome.
Jeremiah, would you tell us about when you knew that it might be time to consult a professional, and what were the signs that you knew something was a little bit different inside you and that you had to address whatever the change was, if it was how you were feeling or how you were able to cope or any behaviors?
Okay. Well, I remember when I was 7 years old, I was in a foster home, and that's where I revealed trauma from other homes. I was hurting myself a bit, and I remember that from like 7 years old. And when I told that foster family about what happened, they sent me to like a children's trauma center to get therapy. But it wasn't until I was 11 that I got on meds and had my first psychotic episode, with hearing voices and seeing things that weren't there. And so I started treatment very young. Um, and in a way, I feel grateful that people caught it early. Um, it's not everybody that gets treatment early doesn't, um, do well afterwards. But with me getting treatment early, I've been able to cope a lot better with what I experience, with what I'd experienced in my past and what I experience now. So.
Thank you so much, Jeremiah. And thank you again, Annette. And I hope that there might be someone in the audience who might be resonating with what you're saying and recognizing maybe some similarities in what they're experiencing, and that sharing your story would let them know that they're not alone, and that mental health conditions can happen to any of us at any point in our lives. And there's no shame in reaching out for help when we need it. So thank you so much for sharing your stories.
Lori, could I just mention that it's great that they got help so early, because the average person suffers with mental illness for almost 10 years before they get help.
Wow.
So it's hard to imagine that people go through trauma and feeling this way for almost 10 years, but that's what the statistics show.
Well, I have to say that I was 48 years old when that happened. Okay, 48. That's how long I was living with that. And I didn't know what it was.
Thank you, Annette. Dr. Harrison, can I follow up on that? Why is there any research to explain why people might wait 10 years to address a mental illness? What are the factors?
I think the primary one is the stigma associated with it. Everyone feels like, well, several things. Most people who are suffering like that feel they're the only one who's ever dealt with something like this. So they automatically assume that nobody else is going to understand. And that they also think generally that there's no hope for these kind of conditions. So they think it's kind of a waste of time to try to talk to somebody about it. But those things are that's just not true. There is hope, a great deal of hope for people. But we have to let people know that many of us suffer with different types of mental health conditions, and there's hope for all of us.
Thank you. Thank you for that hopeful message. My next question, we'll start with Dr. Kene. How do you, if you are working with a family member, how do you persuade that family member that they may need to seek some professional help if they've not acknowledged or accepted that they have a mental illness or a substance use disorder? How do you work with that?
In response to that question, I would suggest that we first kind of reflect on a time that we might have engaged in something counterproductive against the advice that was given to us. And the reason that I suggest that is because resistance to change is a very normal and common factor in our lives. And seeking treatment or seeking help or acknowledging that one has these struggles can be very frightening. And so when approaching that topic, I would suggest not stigmatizing the family member's resistance for seeking help, not stigmatizing their symptoms is an important consideration. Keeping in mind that ambivalence is normal, avoiding arguments And also reinforcing honest communication. Like if your family member does say that, yes, I did drink a lot last night, instead of like having an angry reaction, which I know is easier said than done, I would want to almost reinforce them for being honest with me, because that speaks to them, like their desire to change. Mm-hmm. So, I mean, overall, I would suggest is some of the biggest predictors of behavioral change are people being committed to change. And that has to, although it has to come within the person, family can play a really instrumental role in providing support and helping the person continue to seek mental health treatment. So, I mean, if I were to summarize it, I would basically say is respond to the resistance and ambivalence and the denial without getting into an argument, without shaming them, and being as supportive as possible.
Thank you so much, Dr. Kene. Dr. Harrison, do you have anything to add to that?
Just a couple of things. I think that the way our language makes a lot of difference. And it's often, I think, more helpful to start conversations like this with, I have noticed a change in behavior, rather than starting it with, you were drinking, or you in an accusatory type of fashion. People can't argue with your observations. They may say, well, I don't agree with them, but what you've observed is what you've observed, and you can own that. And you can also add, I think, a term of caring. I'm really concerned about you. I really want the best for you. And it seems like you're really struggling with a lot of things from what I can see. So try to make it personal as to what you're observing. And I agree 100% with Dr. Kene about not putting people on a guilt trip or blaming things. That doesn't really help anything at all. And you can also try to emphasize, as you said, any positive things that they come from that, acknowledging their strength to say, hey, maybe I do have a problem. Anything that you can take in a positive tone is always helpful. I think we need to acknowledge strengths no matter what difficulties are going on.
Thank you so much, Dr. Harrison. And now I want to pose a similar question to Annette and Jeremiah. How has your family supported you, especially early on in the beginning? I know we have some family members in the audience tonight who would like to know how to support their loved ones. So I think this could be particularly helpful.
I got no support from my family whatsoever. My mother's been calling me crazy since I was a little girl. Oh. And when I grew up, she just said, well, you just lost it. So I didn't know anything about mental illness. I didn't know anything about therapists, psychiatrists, help, know anywhere to go. But once I went to Butler, I was in and out of hospitals, and it took a lot of time and patience, for me to get well. Okay. There was an episode where I felt hopeless. I felt alone. And I was looking for my brother, and I had all my meds on me, my psych meds. Okay, so one of them was trazodone, another one was the Seroquel. I think that's the name of it. I couldn't find my brother. So I went to his house to see if his girlfriend's son was there, because we were very close. And I said, listen, Chad, I'm getting ready to take all of this medicine because I'm done. I don't want to live anymore. And he said, can you come back later and can we talk about it later? So I didn't say anything. I just went down the stairs and I went, I don't know where I got water from. I can't remember that part. All I remember is being at a telephone on the outside, the payphone. And then the next thing, I was in the hospital and they were pumping my stomach. So that was my first attempt at suicide. and I've had others also. So thank God I was never successful, and I'm here today, and I can help someone else, but my family wants to keep everything, they don't want to hear about anything. There's nothing wrong with anybody. You're just crazy, okay? Or you just lost it. Something is wrong with you, okay? And there was no help for me. I'm just glad that I did have a cousin who cared, okay? And I did listen to him because I knew something was wrong. Mm-hmm.
Thank you so much, Annette. I really appreciate your sharing that and explaining that to us. And I'm sorry that your family was not more supportive. And I'm so glad that you're still here today, because you are an example for other people who may be feeling hopeless, who may be feeling like they just can't keep fighting, they just can't keep trying. But look at you. You're a peer recovery specialist, and you're helping others. You're leading them down the same path that you tread on your own, and you give them hope. So we're really grateful to have you here tonight, and thank you again for sharing that.
You're welcome.
Jeremiah, where did you find support early on? Did you have a foster family that supported you when you came out of the hospital?
Yeah, so I was adopted at age 9, and I had a little bit of a different adoption. I had a subsidized adoption. And how I can explain it, it was basically they knew that things might go really wrong and my adopted family would not be able to care for me because of the trauma and what I experienced. So when I was 11 and I had my first episode of psychosis, I went to Bradley Hospital, and my adopted father also had bipolar, so he kind of understood mental health, and he understood kind of like my trauma. And what he did for me was he taught me how to play chess, and that was really helpful because I never went back home. I went to place to place to place, but playing chess was like the best thing for me because I could compete with my fellow peers, because I couldn't always play sports or do things with physical activity because the PTSD was so bad and I had a lot of sensory issues, and touch was just not a good thing, contact sports. So playing chess was what I did, playing chess and playing cards. And I'm grateful that my adopted father taught me that. He passed on, but I'm grateful for him for that because it helped me while growing up. So
Thank you so much, Jeremiah. I'm so glad that your father could do that for you, and that it was it was a coincidence or meant to be that he had a mental health condition that he was living with as well, and it gave him empathy and compassion and some insight into what you might have been feeling or experiencing at that time. I'm glad that you had that person in your life.
You know what he said when I first went to that family? He brought me into his room, he used to give these huge bear hugs, right? And and he said, "We know everybody else gave up on you, and I wouldn't." And even though he couldn't keep that promise because I had to go to treatment, that stuck with me, that he said he wasn't going to give up. And he didn't until he died. So, yeah.
That's good. That's good.
Great, Jeremiah. Thank you so much for sharing that. And I hope that inspires maybe some family members in the audience who have sons or daughters who might be new to a diagnosis, and, will feel inspired that saying to your child, to your teenager, I'm not going to give up on you. I'm not going to abandon you, even though you're living through this, and how powerful that can be and how grounding that can be. So thank you so much, Jeremiah.
You're welcome.
My next question is for Dr. Kene. What supports are available to family members or caregivers? And how do you integrate family members into a client's treatment, if at all?
If an adult client, so I'm going to answer the second question first. If an adult client provides consent to include a family member into the treatment, I think that's a great idea because family members can be a great source of information. So, so that's one option. If the adult client does not provide consent, then it becomes tricky to involve family members into treatment. My only suggestion to family is that when they do want to be involved in treatment is to kind of like reflect on what role do they really want to play. And family members, there are resources for them. I know there are support groups. NAMI provides a lot of resources and for family members on best ways to provide support while still kind of taking care of themselves. There are also publications that focus on the discussion of like loving someone with a mental illness. I would also encourage the family member to seek their own therapy to help process their feelings and to just be able to kind of care for themselves.
Thank you so much. That's really helpful. Dr. Harrison, what about you? How do you work with families and what supports are offered to families that you know of?
Well, I'm not really a provider. I'm not a clinician in that sense, but I am an instructor in something called Youth Mental Health First Aid. And the mental health first aid is a great course, I think, for any family member to take, because it really helps you to understand what's going on with the family member who's struggling, and also gives you not just understanding, but also gives you tools that are useful as to how you can interact with them, how you can understand and see when they're facing a crisis or a crisis may be approaching. But it just gives you for example, one of the things it teaches is that you can, how to listen without judgment, how to really just listen and let them be who they are, but understand that that's what they are feeling right then. And whether you understand or agree with it, you can certainly still validate that that's their feeling. You can also, there's always a way to give encouragement to people. You can also give them information about how they can get help for themselves or what other avenues of help there might be around. As well as helping them to get the right professional help for whatever condition they're working with. So I would encourage any family to, besides NAMI one of the things I was going to say, but I certainly agree with NAMI, but I also would recommend for families, as many members as possible, to get the mental health first aid training. That's available in the southern part of the state, down in Washington County. It's available for free. If you go to healthybodieshealthyminds.org, they can give you a schedule of when the training is being scheduled. But it's a free training. It takes about 6 hours to do it, but it's really worth it. Very, very helpful training.
Thank you so much. And thank you so much for sharing that resource and that website address. And I've taken mental health first aid training. It's excellent. And I would recommend it to everyone. I think right now, because of the pandemic, it might be a virtual training, but perhaps they'll go back to in-person soon. But it is worth pursuing if you're a family member or just someone in the audience who may be curious and may want to be better prepared to help someone who may be in crisis. Jeremiah and Annette, what barriers did you have to overcome to get services or treatment, if any?
I couldn't think of any barriers. It seems like there was so much help out there for me. And I was never denied help. And I was just so fortunate that happened with me. I mean, being in and out of the hospital each time, it was never like, well, you were just here. 3 weeks ago. You can't come back. No, they accepted me gracefully, and I received the help that I needed until I got well. Mm-hmm.
Thank you, Annette. That makes me so happy that you did not have any insurance barriers or other types of barriers. I'm really happy. Jeremiah, did you face any barriers and how did you overcome them?
So I experienced a few barriers. Even though I got treatment early, I was very self-destructive, and that prevented a lot of things. Um, there was mainly like 3 serious, attempts on my life. One when I was 11, one when I was 18, and one when I was about 24. And with those decisions that I made, that ended me up in the hospital, it caused a lot of concern for a lot of people, like who would, have a place for me to go, because they thought I was so dangerous. I remember when I was 18 after a serious attempt, and they didn't know what to do with me. I had to, when I was in the hospital at 18, I had to call and advocate for myself all around the country for someone to take me in, because no one wanted to take me in because of that attempt and how dangerous like I was acting. Um, Fortunately, I found Fellowship Health Resources. They almost had the decision to put me into Eleanor Slater Hospital at 18 years old, but I found adult services and went to a couple group homes and had to go to the state hospital for a short time. And then when I was 25, or 25, 24, I had an attempt, and that caused a lot of barriers for me, like with food and rent and all of these things, because when you do something self-destructive, you can lose a lot of things that you've had. Like when you come home, you might not have anything, and that's usually a problem. But at 25, I also got involved with Harbor House and NAMI, and being part of NAMI for the last 10 years has been a real accomplishment for me, because I've never been at a place that long to work and to impact others about my recovery and what hope I try to provide to others.
Jeremiah, thank you so much for sharing that with us. And I'm so sorry that you had those experiences, and I'm so glad that you're here today. And you're absolutely right that you are inspiring people in your work with NAMI and here tonight, because people will look at you and say, wow, this person went through a lot, especially from a young age, and look how resilient he's become, and look how successful he is, and look how far he is on his journey, that he can now be a light to other people walking down the same path. And I'm just really happy to get to know you. Thank you so much. My next question will be for Dr. Kene again. What are some of the barriers that you've seen as a clinician when working with diverse groups?
Some of the most common barriers are, one of the biggest ones being access to resources. Sometimes people from marginalized groups often don't have access to mental health or behavioral health resources that they really need. Language can be a barrier also if clinicians do not speak the language that the client speaks. Also, there could be some systematic stigma within the subgroup about seeking mental health treatment, and that speaking to a quote unquote like an outsider about personal struggles could be seen as something that goes against like the rules or beliefs of the culture. Another barrier barriers also from the clinician's perspective could be that the clinician might kind of see the client's culturally relevant behaviors as being dysfunctional when they really are not dysfunctional or abnormal in that given specific cultural context. And the clinician might be prone to kind of like engaging in kind of like overgeneralizations, like assuming that this client belongs to a certain group, but not really paying attention to the client's identity or the consumer's identity with that specific group. So in summary, I think there are both like systemic, there are systemic barriers, there are barriers also kind of like that come from the clinician, and the systemic barriers that impact the client.
Thank you so much. That's really insightful and interesting to hear about the clinician's point of view and the barriers that you face. I'm sure we have some clinicians in our audience tonight, and so I'm sure that was helpful for them to hear. Dr. Harrison, do you have any thoughts that you can share on the topic of barriers that you've seen in your work through the Washington County Suicide Prevention Program, either watching clients try to overcome barriers or watching the clinicians and helpers of that program try to overcome barriers?
Well, right now, I think the biggest barrier is there's such a long delay in someone being able to get attention. So, for example, if someone goes to an emergency room now for a suicide attempt or for just a serious mental health problem, the average wait time right now is between 5 and 7 weeks to get an appointment. It's just horrendous. It really is. And so I think we have to be very innovative and try to find other ways that people can perhaps get help in the meantime. And I think peer recovery specialists are a great way to do that, because we have the only full-time person on our grant is a peer recovery specialist who has lived experience with suicide attempts, severe mental illness and substance use. And she is just great at helping people get through the transition periods. For example, she makes contact with people who are in a psych hospital and tries to contact them within the first 24 hours after they're discharged. And because that's a very, very dangerous period of time for people. So I think that's one of the great things we can do. I think there are also websites that can be very helpful. One organization or one website is called nowmattersnow.org. It helps both clinicians and patients develop safety plans about how they'll deal with things the next time they feel they're going into crisis. It's a really great system. Man therapy is kind of a humorous approach for middle-aged men that the largest numbers of suicides in the nation and in our county and state are middle-aged men. And they're also the most resistant to seeking help. This macho BS attitude, I'm tough, I'm strong, I don't have to talk to people about things. So man therapy is a very humorous approach to engage that population. And it's been very effective both in Colorado and in Michigan. And we're putting up bulletin boards and posters and lots of efforts to try to get man therapy into the hands of people around our county and the state. If you just go to mantherapy.org, there's really some great information there. They have what's called a 20-point head inspection that helps a guy figure out, am I just being stressed, or do I really have depression or anxiety or something else going on? And there's a lot of video testimonials of people who've struggled with the same kind of things, but they start off just by being very funny. Right now, there's a billboard up down in Hopkinton area, down in the southern part of the state, that says, in line with football season, it says, open field tackle your life's issues. There was one up in North Kingstown that said you can't fix mental health with duct tape. You have to have other things. So it's a very humorous approach to try to get men engaged. And I think it's going to turn out to be quite successful. We've just gotten started, but I think we're going to be able to do that. But I think people need to really look at online resources also for help while they are waiting to get help. So.
Thank you so much, Dr. Harrison. And I have heard that many outpatient behavioral health providers have wait lists. There are more clients than there are providers right now. And that's particularly true during this time of the pandemic when everyone is experiencing chronic stress. And so, yes, it is very helpful to list programs like Man Therapy, so that folks who might go on a wait list to see a provider can at least get some support in the meantime. And as we said, NAMI Rhode Island has some terrific peer support programming and support groups to check out. And it's such a shame that we don't have enough providers, especially in-network providers who accept insurance in Rhode Island. And this is something that the Mental Health Association is working to address through policy and regulatory solutions. But yeah, it is a big problem right now, and it shouldn't be. So thank you so much. And now I'd like to ask Annette and Jeremiah, what has been most helpful to you in your recovery, in your healing? What advice, would you share? What resources or what tips would you share with others?
Well, I think that working at NAMI plays a big factor because it's very enriching and very rewarding for me. It's like I'm blessed to be working there because when I help someone else, I help myself. So I have a lot of resources. I have 2 giant books with resources. And I started these books in 2013. They're gigantic. And it's a good feeling when someone calls and they say, oh my God, I don't know what to do. My son this, my granddaughter. And I have the resources to help them out. And they are grateful. They are so grateful that there was someone there to help them out. And like during the pandemic, when it first started, we have a list of people that are in our peers that are in our files. And I copied off 89 names. And I made it my business to call each and every single one of those peers to ask them how they were doing during the pandemic. And they were like, wow, that's big, I mean, somebody cares, So, but they don't know how I felt doing that, I mean, I felt great behind doing that. And there's something else that I wanted to say. Oh, and mentoring, Jeremiah and I mentor peers also. We have like a one-on-one peer-to-peer program. Like if someone is going through something and they need help, they can call us once a week or we can call them once a week. And we work with them. And that's rewarding also. And the reason it's so rewarding to me is because that's how I got involved. Besides the hospital, that's how I got involved with recovery. Because I walked into Anchor one day and I just didn't know which way to go, I was sober for quite some time. And I just felt that something was missing. And there was a peer specialist there that helped me. And she asked me all these questions and she was writing them down. And from all of the answers that I gave her, she just mapped out my whole future for me. and it worked. It's working. It's still working today. That was in 2013. So I was grateful that there are programs, training programs out here for peer recovery specialists and community health workers so that they can give back. I just took one person to help me and I can help thousands, So it's a great feeling. It's so rewarding. Mm-hmm.
That's wonderful, Annette. Thank you for sharing that. What I took away from that was service to others gives one a sense of meaning and purpose, and also the connection, the connection you developed with your own peer support specialist who helped you when you first began your journey. That social connection and that support and empathy was very important.
Mm-hmm.
Thank you so much. Jeremiah, what about you? What was helpful to you?
So I've tried like several things. The first place was Hillsgrove House. That's in Warwick, and that's kind of like a peer center. They um, work as a they, they go by like a work order day. So basically, you're running the clubhouse, and they provided me with some work programs and to get my GED because when I was 18, I couldn't finish high school, so I needed to get into a GED program, and I went in that, completed it in 4 months, kind of the same time I would have completed high school, so that was good. Um, but things like that, like clubhouses, places like Oasis Wellness Recovery Center, just going somewhere just to talk to people and sit around, have coffee, and because sometimes when you have mental illness, you don't know who to talk to. So
Mm-hmm.
being around your own peers and being able to talk about your stuff without judgment, without shame, is a really rewarding thing. And even though I've had, some bad times and some self-destructive behavior, always going back to my peers and talking to my peers, even in hospitals, right? The best experience I had was actually connecting with peers. It wasn't so, I mean, the staff did their job, but talking to peers was really important. Um, I've been trying to work since I was 18, and and work is also another tool that's really helpful.
Mm-hmm.
And being able to accomplish 10 years at NAMI, that makes me feel really good. And I do a lot of the trainings. I'm a connection trainer. I train facilitators to run groups. I lead people in peer to peer and 8-week recovery education course. I've taken a lot of other trainings like youth mental health first aid, adult mental health first aid, QPR, question, persuade, refer, and other programs like emotional CPR I took. So all these trainings mean a lot because it's gets us to move forward and stop backtracking to old behaviors and you know old stuff, and make everything new. And that's what I think that I got out of it.
Thank you so much, Jeremiah. And again, I'm hearing this common theme of having peer support is hugely important because you have someone there who's been on a similar journey and can cheer you on and share what was helpful to them and what got them through it. And then to let you know that you're not alone. And again, that social connection piece and being of service to others, I'm hearing from Jeremiah as well. And the trainings you said were very helpful. So, wow, thank you very much for sharing that. And that just, reinforces how any advocacy we do in Rhode Island for, the mental health community, for building out our continuum of care, we really do need to place a special emphasis on peer support specialists, funding them and making sure that we have enough of them. So our time is growing short, but I wanted to ask each of you if you had any final thoughts or advice or what you would say to someone in the audience who might be new to the realm of mental health, and what you would say to that person who has maybe perhaps a new diagnosis. Dr. Kene, would you like to start?
Sure. I would like to say two things. One is that people are more important than their diagnoses. And the second being that you are not alone. What you're struggling with, other people are struggling with, they have struggled with those. If anything, this connects you to other people. So I just want to kind of like offer that there is hope, that there is treatment available.
Mm-hmm.
Thank you so much. Dr. Harrison, what about you? What would you say to someone who's new to this realm?
Well, I think like Dr. Kinney said, hope is so important. And I think people need to know that the last studies I looked at, somewhere between 85 and 90% of people with diagnosed mental health problems can be treated successfully. it often includes a combination of medication and talk therapy. That combination is almost always better than either one by themselves, but people can be treated. The other thing I would encourage people to do is to get as much training as you can, not only the mental health first aid, but as Jeremiah mentioned, QPR, which teaches any adult how to recognize that someone may be thinking of suicide, and how do you ask the question directly and help them get some help. Just as an everyday person, all the government programs in the world aren't going to make a difference until the average citizen can recognize that their friend or their neighbor, their coworker, or relative is struggling and needs some help. And you can help them get that help, and you can save a life. So anybody can do this. We don't have to depend on the experts to save lives. We can all do it. So it just requires caring and being willing to put yourself out there. So, and I really applaud both what Jeremiah and Annette have done in their lives. And I greatly honor you, and thank you for being such great examples.
Thank you.
Thank you, Dr. Harrison. Thank you so much. Annette, what would you say to someone in the audience? What could you share with them?
Okay, I wrote something down for that. Okay. I know that in my generation, it was never discussed with mental illness, not even substance abuse. And there was a lot of that from my father and that wasn't discussed. It was a thing. And you should be the one that breaks the cycle. And if your family is like that, by not being in denial and by facing facts and getting help for yourself. And if you do decide to get help for yourself, don't do it because someone else gave you an ultimatum. Do it because you want to do it, because that's when it's really very effective. Okay. And there's plenty of help out there. There is plenty of help out there. All right. And if I knew that there was something was wrong with me, and what it was, and the help out there I got, I don't think I would ever have picked up a drug to sedate myself and to keep holding feelings and to make myself feel better that way. It's much safer to feel better this way, dealing with your problems and controlling them. Mm-hmm.
Annette, thank you so much for sharing that. I'm sure you've touched someone in the audience. Thank you so much. Jeremiah, what would you say to someone in the audience who might be new, have a new diagnosis or new to this idea of mental health, mental illness?
So one of my co-workers, Penny Ferrara, said, suicide is a permanent solution for a temporary problem. There is always hope, and recovery is not only possible, but it's probable. Like Dr. Harrison said, if people seek treatment and do peer work, you said what, 85-90%, Dr. Harrison? Yep. can get better. So it's real. Like there are living examples of people that got better and they could have lived the most worst situation. And one of the things we say in our trauma group that we do on every other Thursday is that we don't only have to be survivors of trauma, but we can be thrivers and overcome it. So that's what I believe, and that's the message I would give others.
Yeah, I would just like to add that I strongly believe, honestly believe that there's always another option to suicide. It may take a while to find it out what that option is, but there's always another option, so you can go on living and have a great life.
Well, thank you, Dr. Harrison, and thank you, Jeremiah, for those hopeful words. I would now love to welcome questions from the audience. You can feel free to type them into the chat or the Q&A box, and I can read them. We've gotten so much good information here tonight, and hearing Jeremiah and Annette's stories, I think, were so powerful, and you are an example for others to follow, and you inspire me in my healing with my illness. And I'm really so proud to have you here tonight, and look forward to getting to know you both more. Any questions from the audience right now? Okay, what I want to do is I just want to put a couple of resources into the chat box for everyone. One is on stigmatizing language and how we can change from stigmatizing language to more person-centered language. That's called Language Matters. And did that make it to everyone, or did I can do it again if not. It might have just gone to one person.
You sent it directly to me, Lori.
Sorry, Jeremiah. It keeps shifting to my default. I apologize. Let me do it again right now. So here comes Language Matters. And then here comes another handout that was everyone or some members of the Mental Health Association's Diversity, Equity, and Inclusion Advisory Council chipped in to add resources to this shared document, which I tidied up and I'm going to put in the chat as well. I know Jeremiah has to hop off in a minute, so I do want to say thanks again, Jeremiah, for being here tonight and sharing your story. I'm inspired, I'm grateful, and you're so strong, and I'm just happy to have met you. I haven't met you previously, I don't know how, but I'm so glad that we've crossed paths tonight. So I wanted to say that before you hopped off. And I will put the resources in there as well. And Mental Health Association has a resources page, which I'm putting the link to in the chat as well. And on the top of our resources page, we have an English and a Spanish downloadable, clickable resources e-booklet, which has a lot of local resources in the state of Rhode Island. And of course, NAMI and Oasis Wellness and Recovery Center are in there as well, as many other resources people can look through. So that is there as well. Again, I want to thank Dr. Harrison, Dr. Kenny for your time this evening. I'm really grateful, and I know how busy you are, so I don't take it for granted. And thank you, Annette, again, for sharing your inspirational story. Thank you to everyone in the audience who participated. Dr. Kenny has put her email address into the chat if anyone needs it. Oh, we actually do. We do have one question from Larry Wilson. He asks, how do you keep the music playing? By that, I mean, how do you keep the love for the adult who suffers with mental illness alive when this person might be abusive, won't consent to any help because this person might be in denial, is cruel, and really turns the family members into victims? This is hard. Any advice for Larry?
I just want to quickly chime in. I mean, that sounds like an incredibly difficult situation. I also so there is the mental illness and the substance use piece, but I also want to kind of like shine light on the issue of intimate partner violence, or what is generally labeled as domestic violence. And there are some resources for that also. So, I mean, if there are concerns about anyone being abusive or cruel, then I would suggest that the individual seek help from resources that are geared towards survivors of intimate partner violence.
Thank you so much, Dr. Kenny, for that. And what would you say to a situation where it might be a family member who might not be physically violent, but maybe, verbally abusive, very confrontational, disagreeable because this person is having a difficult time with perhaps a new diagnosis? What would you say to help with that dynamic?
I mean, I would suggest validating, listening to their emotions, right? So underlying there's probably fear, there's shock, right? There's anger or frustration, validating those feelings without really reacting to the behavior. We don't want to reinforce the behavior. That's what I would suggest.
Thank you so much, Dr. Kenny. Dr. Harrison, do you have anything to add?
I think that anytime we're really struggling with whatever's going on in our life, there's nothing wrong with seeking help ourselves. Seeking a counselor just for our own health and welfare. So that's the only other thing I can add to what Dr. Keenan said.
Mm-hmm.
Thanks. Annette, do you have anything to add to that?
Well, we have family-to-family support groups, and we have a family-to-family education course also. So that is geared for those whose loved ones are living with mental illness or mentally challenged. And everyone in the support group and everyone in the class is going through the same thing. They have a loved one. So it makes it, I think that is very helpful because it explains all of the mental illnesses and the diagnosis and the symptoms and all of that and how to deal with it and stuff like that. So, and with the support groups, you can talk about it, because if you can't talk to that person, at least you can talk about it in the support group. Getting it out is so prevalent. It is so important to get it out instead of stuffing it, because it could take a serious effect on yourself,
Thank you. Annette, one more time, what's the name of that program at NAMI? Is it Family to Family?
Family to Family support groups.
Okay.
And the family, Jeremiah's education course.
Jeremiah.
It is Annette. It's family to family education class, and then they have family support groups.
Right.
Thank you so much, both of you. One more question from the audience. For those who don't have a supportive or caring family member, how do you cope with it? How do you really explain what you need to them being your family? Anyone can jump in.
Well, in my case, I couldn't speak about it. It was just a thing. So, leave me.
Dr. Harrison, did you have a thought?
Not a lot. I think maybe you can say, okay, I will listen to you if you will then listen to me for a few minutes, and just say, let them know honestly how it's affecting you, and that you want to help them, but you have your limits of what you can take too. I don't know. I would rather have Dr. Kenny recommend her thoughts.
I think those are great suggestions. I would add to it that it might be important for the individual to establish support outside, and to, I know this is easier said than done, is sometimes accepting family members for who they are and not using their rejection to mean anything about you. That's what I can offer.
Well, thank you all. Thank you all very much for your insight tonight.
Thank you for inviting us.
My pleasure, Annette. Really, I'm grateful to you. And thank you to our audience for sticking with us this evening. Please sign up for the Mental Health Association's newsletter so you can learn about upcoming events we'll be having and policy work that we may want to inform you about and you may want to get involved in. And I want to thank our panelists again, Dr. Harrison, Dr. Kenny, and Annette. Thank you so much for sharing. And with that, I bid everyone a lovely evening. Thank you so much.
Thank you.
Good evening.
Bye.
Bye-bye.
Have a good night.
Good night, everyone.
Good night.